we're tackling a critical topic for your health insurance exam, the Health Insurance Portability and Accountability Act of 1996, better known as HIPAA. The exam will hit you on two main fronts, portability and privacy. Let's start with portability. This is all about ensuring you can move from one group health plan to another without losing coverage for pre-existing conditions. While the Affordable Care Act prohibited pre-existing condition exclusions, you must still understand the original HIPAA rules for the exam. HIPAA limits how long a new group plan can exclude coverage for a pre-existing condition. A pre-existing condition is defined as a condition for which medical advice, diagnosis, care, or treatment was recommended or received within the 6-month period before your enrollment date in a new plan. A group health plan can impose a maximum pre-existing condition exclusion period of 12 months, or 18 months for a late enrollee. This is where creditable coverage becomes vital. Creditable coverage is prior health coverage you've had, like from a previous employer's group plan, Medicare or Medicaid. Your new plan must reduce the maximum pre-existing condition exclusion period by the length of your creditable coverage. For this to apply, you can't have a break in coverage of 63 or more consecutive days. For example, if you had 10 months of continuous creditable coverage and then joined a new group plan, the maximum pre-existing condition exclusion they could apply is only 2 months, not 12. You prove this with a certificate of creditable coverage provided by your old plan. HIPAA also grants special enrollment rights. This allows individuals to enroll in a group health plan outside of the regular open enrollment period. Qualifying events that trigger a special enrollment period include the loss of other health coverage, marriage, birth, or adoption of a child. The individual generally has 30 days from the qualifying event to request special enrollment. An exam trap is to confuse this with COBRA. HIPAA provides the right to enroll in a new plan, while COBRA allows you to continue your current plan. Now let's switch to the privacy and security rules, which are a huge focus on the exam. The privacy rule protects an individual's protected health information, or ePHI. ePHI is any individually identifiable health information held by a covered entity, like a health plan or provider. This includes names, addresses, birth dates, and medical records. The rule sets limits on the use and disclosure of ePHI without the individual's written authorization. A key concept is the minimum necessary standard, which means a covered entity must make reasonable efforts to use or disclose only the minimum amount of ePHI needed to accomplish the purpose of the request. The security rule is a subset of the privacy rule and specifically deals with electronic protected health information, or ePHI. It requires covered entities to implement 3 types of safeguards. Administrative safeguards are the policies and procedures that manage the workforce, like security training. Physical safeguards are measures to protect physical access to electronic systems, like locked server rooms. Technical safeguards are the technology-based protections, like encryption and access controls, to protect ePHI. A common exam question will present a scenario and ask if it's a privacy rule or security rule violation. Here's a simple way to remember it. Think privacy is for paper and people, security is for systems. If the breach involves a physical chart or a healthcare worker gossiping about a patient's condition, that's a privacy rule issue. If it involves a hacker accessing the hospital's database or an unencrypted laptop being stolen, that's a security rule violation. Remember, privacy is about who can access information, and security is about how that information is protected electronically. For free practice questions, AI-powered explanations, and more exam prep tools, visit openexamprep.com. That's openexamprep, all one word, .com.